Hey everybody, welcome to the Precepting in Critical Care class session. I'm nurse educator Krista Rachinsky, and I am here with Jeanette Rack
Hi, it's Jeanette. Nice to see you again.
and Allie Martin.
Hey, it's Allie. Nice to see you again.
Yeah, and thanks for watching these sessions. As you know, we are doing some of these sessions recorded virtually so that you can watch them anytime that is convenient to you. And we are hoping to give you some good conversation and scripting tools about how to give and receive meaningful feedback. It is super hard. I think some of you have heard me refer to feedback as the other F word because it's just awkward sometimes to give. It takes practice, and it really challenges us to dig into our language tools that we were raised with and that we have developed over time. And so because of that need to develop them over time, we are going to be talking about feedback today because we want to give you some tools and things to think about for how to develop your skills in giving and receiving feedback as it pertains to precepting here in critical care. Okay, so let's dig right in. So I know we've talked about the roles of preceptors before, so this is just a little review for you. But all of you watching know that, as a preceptor, you have to be, all of these things and sometimes all at the same time, which is really hard. And so feedback encompasses each and every role that you see here. So how you present at the bedside as that competent clinician, how you model things to be that example. So how you role model, how you lead, communicate, advocate, evaluate, educate, and socialize this person. Feedback is encompassed with all of these roles. So just to refresh about that, that's what we do as the preceptor. And we're gonna get into, this is my little formula of something I said in an earlier session, but when I think about how I give feedback in a helpful way, so I'm keeping the conversation space psychologically safe, which is super important. Someone cannot hear what I'm telling them if I have belittled them, if I have dishonored, disrespected, if I've done something that has taken that oxygen out of the room. I've made it psychologically unsafe. It doesn't matter what the helpful pearls of wisdom are because they can't hear them. And so, what I want to offer you as a tool that's been helpful for me is when I start with, hey, my intention is to help keep you safe and to improve this part of your practice. And then I start with the intention and then I follow it with either it's a question or it can be also a comment because we're talking about feedback, that give and receive. You guys know I'm a curious person. I like to ask questions. And so the way I invite somebody into a dialogue and gauge where they're at is I say, hey, it's my intention, Jeanette, that that we're going to work on how to do this hemodynamic assessment together. And so what can we do to set you up for success? So there you just saw me say, my intention is this. And essentially what I want her to know is you can trust me because my intention is not to make you feel dumb or to belittle you or to puff myself up and make myself feel good at your expense. That's not my intention. My intention is to, and then I state my intention, and how can I do that for you? How can I help you in this time? So anything to add on to that? That's just my take on it. And I know, I mean, Allie and Jeanette have a lot of experience in precepting and in teaching in their own right. And so I know that they have their own way about this as well. What do you guys think?
I think I think it's hardest to give feedback in the moment sometimes when it might not be always the most positive feedback. It's a constructive feedback, but kind of like you've always learned, you positive, negative, positive, the feedback sandwich. But just always looking for what went well. And this will kind of go into what we're going to talk about, the engaged feedback checklist. It's part of it, kind of like honoring the good things that went on, and then maybe areas of improvement or what could have gone differently. And then also prompting, almost like a debriefing sometimes is what I try to do. Kind of after any situation, you know, that might be big, or somebody's, crashing, or whatever the situation may be, like kind of after that specific situation is safe for the patient, and for us as providers to kind of take a step back for a minute and just debrief it in a way. But I think that also kind of helps. If you think of it as a debriefing, it will automatically come into a feedback, because it'll be more of a dialogue opposed to like, this is what you did wrong, or this is what you need to improve on. It kind of opens it all up, and so it's a little more of a comfortable situation.
Totally. Yeah. What do you think, Jeanette?
I agree. I on the engaged feedback checklist, I find that people often struggle with holding accountable without shaming or blaming, using your words and trying to find a script that works in order to give feedback, like you mentioned, without putting up blinders, without with somebody hearing you, is very difficult. I think I haven't found a perfect script that actually works. And so I really appreciate Kristen's suggestion of like why I'm giving you this feedback. What is my intention of pointing this out, so that we recognize and acknowledge that it's coming from a good place. It's not coming from a really critical, or this is the standard that I'm holding you to and you're not meeting this standard. It's saying, like, I want this patient to be safe, and I noticed this area was missing. Is this because this is something maybe you don't understand or that you want to delve deeper into? What I often fall back to is sometimes blaming myself. Maybe I didn't teach you this. Maybe we didn't go over this aspect. Maybe I failed you as a preceptor, and I noticed that then maybe this part is missing. That can be helpful, or, sometimes not helpful, because then the intern doesn't always take responsibility. But I find that if I can state my weaknesses, sometimes that allows a safe space for your intern to state their weaknesses.
Totally. And you just said, hey, I'm going to role model this for you. I'm going to role model and tell you, hey, I'm not perfect. There's things I don't get right. And, you don't have to say the word intention all the time, but, I have a heart as that icon, because in crucial conversations, they teach us start with heart. If you make it psychologically safe and you keep it there, then your intention is going to be on point. As soon as it gets not psychologically safe, it's because we're doing all this stuff wrong. So we want to take, this is work by Brene Brown, and there will be a supplement for all these virtual sessions that's going to include all the reference material of what you see us talking about, and we'll provide all those resources to you so that you can get into them. But the engaged feedback checklist, there's a lot of good things out there that you can use to really guide you. And we wanted to dig into the 10 things on this because they really cover it all. And there's a lot of ways you can do this. How many times have I even said, I don't know if you knew this, but you didn't scrub the hub before you attached that Zofran. Or what were you thinking, Allie?
Oh, I was just going to encourage everyone, if you feel like you want to improve some on just learning in general, I have it right.
Yep.
So background, the Dare to Lead book by Brene Brown, I found super helpful. I'm almost a little over halfway done, and it has all of this in there. Kristen recommended it to me, and it's been very helpful in different perspectives and kind of learning how to work through this, that I think could be helpful for all preceptors. So just side note, but I highly recommend it. And I don't really like to read, so it's saying something for me if I have put the time into it to read and not just skim. So
yeah, I just realized that in this session you're not really seeing my video at all. You're gonna just see Allie and Jeanette back and forth, and that's fine because you see me all the time. But sorry for that video, whatever is happening there with our our presentation. All right, so we want to get into the engaged feedback checklist. So as we talk through these, we're going to give some examples or some scripting tools just to help you sort of wrap your mind around what's going on and how do you apply this, and how is it meaningful to you as a preceptor. So I know I'm ready to give feedback when, number one, I'm ready to sit next to you rather than across from you. So this makes me think about I'm not wanting to be your adversary. I'm wanting to be your ally. I'm wanting to partner with you, get in that foxhole with you, shoulder to shoulder, and say, hey, how can we put the problem in front of us? And in fact, I think I just jumped it to number two. I'm willing to put the problem in front of us rather than between us. If I'm next to you, Allie, then I can't be squaring off with you. I'm next to you. We're both looking at the same problem.
And it truly is a problem. Like if it's something that's, when you're giving feedback, if it's an issue that's being brought up, it is truly a problem per se between the preceptor and the orientee or the preceptee, because it can't be just thrown behind you. You've got to tackle it head on, and it's not to bring you further apart. It's to bring you closer together and to build that trust throughout the preceptorship, I think.
Totally. Jeanette, what do we think?
And I think part of that too is a lot of times we go to our other colleagues and we say, hey, I'm precepting this person and I've noticed these problems. And you kind of address it with your colleagues, and it seems you're able to articulate yourself way better with other people than you can often articulate it with the person that you're intern. I think it's okay to do that in order to find the right words to use with your intern, but sometimes we end up then maybe not addressing it directly with the intern.
Yeah.
And just be really careful with those kind of scenarios, because what we want to do is help improve and welcome our colleague, and not just discuss what they're struggling with behind their back.
Yeah, we want to talk to them, not about them, right?
Mm-hmm.
Yeah. I find that, when you were saying, hey, you need to invite more people into the problem solving process. And so if I were, to go to, you, Jeanette, as an expert and say, hey, Allie and I noticed this problem, and this is the component of our problem. And I maybe list that out. And I said, what do you think we should do? Or how have you approached this before? I use inclusive language. We, are, us. I don't say, well, Allie did this wrong and we need a better way. So you've done this a lot. What do you think we should do? Right?
Right. I think that's a great way. I also find that's a way to show your intern that that's how you utilize your resources. It's perfectly normal and, promoted to be collaborative. And, every day I'll run stuff by the people I work with, or, hey, do you think I should do this or this? But, also, that also teaches them how to formulate, what they're presenting in this is the situation, SBAR format, on how to verbalize things more clearly. It teaches them how to collaborate with others. It teaches them how to be aware of things that they're not, maybe it's okay if they don't know the answer. So I think that's role model. It brings a lot of things together when you kind of, work with another colleague too, like, hey, we were thinking about doing it this way. Do you do this differently, or how would you go about this? I think that's super helpful.
Yeah. You're opening up, you're being vulnerable to ask a question and invite whatever feedback may come, right? Number 3, I'm ready to listen, ask questions, and accept that I may not fully understand the issue. The last part of this is something that I think I personally like to keep in focus, because I don't want to make a decision or come to a conclusion based on incomplete facts. And also I acknowledge that because so much information is required to make a completely informed decision, that it's okay to say, I'm never going to have, 100% of the information. I am going to approach it from a good intention space and try and understand this the best I can, because, in light of the goal, it's to create this deliverable for this person, or it's to help provide clarity for this person, or whatever the issue is that needs to be solved. But the last part that says, and accept that I may not fully understand the issue, it's a way of like letting myself off the hook and be like, you don't have to be certain about this. Like, there's no prize for being right. Like you said, Allie, last time, it's not about being right, it's getting it
But
right.
doing it right.
Yeah. So I think number 3 adds a lot of really tough components that that are hard to do when you're, emotionally keyed up. You're in the middle of a shift. You might be at the end of it. You might be tired. Do you feel like listening, asking questions, and being open to being like, well, it's okay that I don't fully understand this. This is a hard thing to do.
I think too, picking when you said not with the times or whatever, not picking when you're, yes, in the moment feedback, but if it's something, making sure the space is safe, like if it's at the end of the shift and you're exhausted, like,
Yeah.
Trying to kind of schedule that feedback time when it's optimal for both parties, not
Not-
just giving
not a
it,
good
but
time.
also the one receiving it. So
Yeah. And in that way, if there's something that it's not super time sensitive, that we talk about it right now, and I realize my energy tank is running pretty low and I can't even put together a comprehensive sentence right now. Jeanette, you described like near the end of your day, you're like, like it's really hard to just be articulate when you've been thinking out loud all day. And so I think it's all right to say, hey, I really want to talk about this with you. And I want to give you what you need to feel successful, but I know I'm just not in the best frame of mind or energy, or I want to give you a better version of myself in this conversation. So let's circle back next shift, or let's circle back tomorrow, or whatever it is. All right, number 4 is I want to acknowledge what you do well instead of picking apart your mistakes. That's a good one. What do we think about that, Jeanette?
I think, Allie mentioned the compliment sandwich, kind of where we give a compliment and then we note something that could be improved upon, and then we compliment again. And I think there's a personality type that probably hears only the compliments, and I think there's a personality type that hears only the middle sandwich part.
totally.
And we all know somebody in both of those categories, probably in our lives.
Oh boy.
And so I think just keeping that mindful. A lot of times we do compliment sandwich because we don't feel great giving that middle part. It's like, well, if we make them feel good on both sides and give them a little hug of compliment, then they're not going to feel so bad about themselves if maybe they're struggling in this middle area. But if that's the only way that we give compliments, people might not hear how well they're actually doing. And so making sure to kind of build up their strengths and make sure that they are having confidence is really important on a fairly regular basis, I think. Totally. Especially when you're in a new scary environment like the ICU or the PCU.
Mm-hmm. Yeah, and back to the generational workforce awareness, and just saying, hey, in addition to different personality styles, we got all these different age groups, and so our Gen Yers and our Gen Zers and our Gen Xers and our millennials and baby boomers, and depending on what vantage point they come from, you're right, Jeanette, like they could hear the 2 compliments that you paid on either side of that tough piece of feedback, and their brain just did not hold on to that feedback at all. It just dropped it right out, and they think they leave that conversation feeling like the best thing. Oh, I'm doing everything right and awesome. And you're like, no, there was actually something in the middle that was something for you to think about and work on and improve. So what are some scripting tools that we use around this? You mentioned the feedback sandwich. You got a positive front and a feedback piece in the middle that can feel negative, and a positive ending. And that's generally helpful for people that are too hard on themselves. And so you need to buffer it, right? And then there's like, hey, so like something I've used for millennial and Gen Yers is, hey, how did that go for you? I ask a very poignant question about a very poignant task or process. Hey, how did that IV placement go for you? Tell me what went well for you. okay, what was hard for you or what did not go well for you? Yeah. Allie, what you got?
I was thinking that's kind of when when I was saying like about the debriefing, I think like how we would debrief a code, what went well, what could have gone differently, um,
Totally.
what what could we do to further improve the situation, and like how are we going to get to that point. I think of almost doing that. I found myself here recently doing that with someone. It was like, um, what's going on here? How are you feeling in this situation?
Mhm.
um, what's causing this? What can we do about it? How are we going to improve upon this? um, and what could have gone differently to make the situation or the outcome different?
Mhm.
um, what can I do for you, or how can I be present for you to help you in this situation? And always having a solution in mind, I think, too,
Mhm.
to, or at least some sort of a solution to, be able to resolve the issue or help the orientee move forward, whether it's knowledge or education or, a resource of some sort, or just tools and tips of how to diffuse a situation. I mean, it could be anything that but almost keeping those open-ended questions, to me, is helpful. I don't know, where it
Yeah.
does it makes it open.
Yeah, absolutely. And so, um, what I heard you just say was that you use questions
Yeah.
to get information from your preceptee, from your intern. Hey, how did that go for you? Tell me more about that. Where do you think you want to connect next time to improve? Questions. Yeah. Versus, I'm going to tell you what you did wrong. I'm going to tell you how I saw that.
I
Instead
think
of
I use
telling, we ask.
Right. I think I use questions. And then I also think if it's like a shortcut that I know would save time, or if they're doing something like the long way, where because that's what they were taught in whatever epic class or whatever it may be, just say, hey, can I show you something that's, you don't have to, this is just a trick I have that
Hmm.
saves me a ton of time. Do you mind if I show you that? And if you like it, use it. If not, then so be it. Kind of just like giving them that option. But I'm not trying to tell you what to do, but this is going to save you 4 phone calls if you just look right here. And ultimately but when you're like, hey, here, look at what I do, then you close off because it's like,
Yeah.
well, I'm doing fine. But just being like, this really saved me a lot of time.
Yeah.
You know, or also framing feedback like, this is something I've come across before, so I don't want you to make the same mistake I did.
Hmm.
I know
So
that.
you're role modeling in that moment. You're
Right.
saying, "Hey, I've been down this road. Don't fall into these holes." That's really good. Yeah. And I love the way you used a question to say, "Hey, can I show you? This is the way I do it. This is what works for me. Take it for what it's worth."
Yeah.
Allowing our new colleagues to develop their own practice, almost like a buffet, that they're going to take a little bit of Kristen and a little bit of Allie and a little bit of Jeanette, and they're going to mix it together and make it their practice, because legally they have to own their practice, right? And it can't be just do what I do. In fact, actually, I want to touch on something that we've seen from time to time, which is you have a new intern, and when they're with a certain preceptor, they are really good at mimicking and displaying what what that what that preceptor is showing them. And then they get with another preceptor and they mimic that person. And then they get with another person and they mimic that person, but they don't own any of it. What do we do with that? Have you guys seen that?
Not, I think it's hard to see because they're with us and they're mimicking what we see. And I think we have a hard time right now in our culture giving handoff from preceptor to preceptor.
Okay.
So
Yeah.
I would say that's totally true. And maybe that's just a little bit of a segue into being super mindful of trying to hand off, and being like a collaborative team, the preceptor team for whatever intern there is, and just being mindful of touching base with that person so that the intern gets the best outcome and the best orientation possible. And so it's easier for the preceptors for that matter. So you're not doing double work.
Yeah, totally. All right. It's good stuff. Um, just as the preceptor, be aware that they could be putting on a really great demonstration for you in that moment. And so the more I think you ask the questions that say, hey, so how's that going for you? Or what part of this are you resonating with? Or, how do you see this being integrated into your practice? Whatever questions you use that are those deeper, engaging type questions, really in that moment help them decide, what they're going to take and what they're going to leave, or what they want to get clarity on.
I like to ask the question, what do you think's going on? And then why do you think what you think is going on is going on? Kind of like asking for that rationale behind them not just spitting out the diagnosis, but why do you think that? Because they can read that in the chart, but what are you seeing that's proving that? Kind of makes a little bit of delving deeper, and you can kind of work further into a little more, a little more things if you have a little more information on why they think something.
Yeah, totally. All right. So number 5, I recognize your strengths and how you can use them to address your challenges. This is something that I think we were sort of touching on right before we started the class session, where we were talking about how you can pay a good compliment, how you can give recognition. In the, you're on the unit and you see something that is like, hey, you just did that really well. And you call it out and you say, hey, that was so good. I love the way you did these things in this order, or, the way you followed this process. That was really good. And saying it from a place of, genuine recognition, appreciation, really being careful to not be disingenuous or sarcastic. Like, oh, that was so good in there, or it just, yeah, we want to pay a compliment for real, but this is a really powerful feedback when you can say, hey, I just saw you in that moment and you crushed it. That was amazing. I'm so proud of you. That means a lot. There are times that I can vividly recall in my memory as a new nurse when I was learning, and it was scary. And people that were experienced, that were my colleagues that I trusted, the few times that they did that, that meant a lot to me.
I think we have a very competitive internship program, and people apply, and we don't currently hire new grads. So everybody we hire into our internship program has experience as a nurse in some aspect, and our experience in life in some aspects. And they all bring with them strengths that got them hired into the internship, and also made them strong nurses where they were. And touching on those strengths and pulling from those strengths can help build confidence and help them to tackle new challenges. I think it's really just important to keep that in mind, to keep reminding people that they are experts in certain areas still, even though they feel so new and so scared.
Yeah, and you gave a nice example of that, Jeanette, when you were just sharing about your own experience working with Dale, right?
Yeah, did we record that part, or was that off record?
No, I think we did. I think we captured that in the virtual session because, well, I don't know, but if we didn't, what I remember you saying is that, you were a new nurse to MSICU. Your preceptor was really good at doing this with you, and he recognized that you were an expert in peritoneal dialysis, and you'd been from 3 South, and you had all these, you don't just come with nothing to offer and so you're finding that strength. And he did a good job of managing up for you and saying, hey, well, Jeanette's an expert in CAPD, let's pull her into this conversation. And, if you want to share anything about how that, what that did for you in that moment.
I think at a certain point when my colleagues were reaching out to me without him managing up, made me feel like part of the team. And when I was still a new ICU nurse, even just right out of my internship. So that was a really great way of him broadcasting my strengths to the rest of the team, so that when I was on my own, I felt that was kind of my foot in the door of how I started to feel part of the team.
Yeah, that's awesome. It's really good to do this. I would say every time you do a good job, finding the good and praising it, it's building trust. And there's some language tools that Brene Brown uses in a lot of her books, Daring Greatly, I know, where she talks about, the marble jar, and how trust is earned in small increments of genuine connection and real dialogue. And so every time, you have one of those moments, it's like a marble that goes in the jar. And then for times where you really need to rely on those strong relationships, like it's getting real. We just went way over matrix. Somebody just got hurt and there's a code coming in. Like whatever the issue is, and you need to pull together. Those are the times that you have the trust there. It can't be forced in one moment, and it can't be just trust me. Just tell me, like, just listen to what I'm doing and trust me. Nope, that's not the way it's earned. It's earned in small increments of time. So, and that's one of the behaviors that you can do to really build that. All right, to the last half of the list. I know I'm ready to give feedback when I can hold you accountable without shaming or blaming you. Jeanette, I think you were sharing a little bit about this earlier.
Oh yeah, just sorry, I'm just forgetting the example that I
You had a
had.
good one. Well, you talked about the sandwich, the compliment sandwich, and then I pulled it into a multi-generational contrast, but I don't want to make you feel bad. I can hold you accountable. So let's just pull that apart really quick. Holding somebody accountable is done really well when we're looking at the same set of rules or maybe the same skills checklist or something. And I say, hey, I noticed that you skipped these steps. And so because of that, we need to go back and we need to fix it. There might be harm that was caused to the patient. Let's say we're doing a high alert medication independent double check process. And, maybe, it's you and me, Jeanette, we're going to go do it. We're going to go put up the heparin. And I skip the step that where I check the order and the right protocol. I think we're on a VTE protocol and we're really on an ACS protocol. So I get the lab value wrong. I don't adjust it right. And now there's a consequence to the patient. So you hold me accountable in that moment by removing feelings and language that would make me feel dumb or, was I wrong? Yes. And that's where the accountability is helpful. But I can still have a conversation that you keep psychologically safe because you purposely don't shame or blame me. You can't come into there and be like, God, Kristen, I've told you 100 times, you got to follow this process. How many times have we been through this? Right? What did I just feel in that moment? How do we show up as our best selves as preceptors when it comes to holding people accountable?
I also think taking a deep breath and being mindful of what you're going to give back in like a unsafe moment like that. Because it can be frustrating when you come across unsafe moments and you're wanting to hold somebody accountable, but then also you want your patients to be safe. And I think taking a minute to reflect on yourself and like, okay, what are my intentions of this? And take a deep breath and like, okay, we're all human. That we're just, it's just a factual issue. It's nothing against you. It's not personal. Oh,